The Age-Friendly Health System initiative has in some ways surprised us. There's a ton of momentum and energy and interest in the Age-Friendly Health System initiative. We've got over 120 health systems now working on it, 300 locations across the country, in 37 states. It's just an enormous amount of interest in this. So the question for us immediately became, well, how do we create a supportive macro environment? How do we create an environment that supports these organizations that are willfully coming forward with energy and enthusiasm? How do we support them to adopt and then spread age-friendly activities within their environments? And so you start to get into questions around policy and payment and workforce support and other things. And what we're seeing right now, in a relatively early stages of this macro environmental changes, we're starting to see some loosening, if you will, of some interest and support from various different agencies in both the federal government and at state level. And I think that's been very energizing. There's work that HRSA has been doing on the Workforce Training Awards that has incorporated age-friendly thinking into their large geriatric workforce enhancement program. This is one of the foundational training programs for all geriatric care providers that now speaks specifically to the 4Ms and to the age-friendly health system in its RFP. We're starting to see interest from deeming agencies, accreditation agencies, and certifiers that are interested in offering age-friendly designations of some kind that, again, would support health systems to adopt these practices. There's a corollary to that in the emergency department. There's already an accreditation that's being offered through the American College of Emergency Physicians for geriatric certified or accredited emergency departments. So there's precedent in this space around certifications and accreditations. So we're starting to see some of that. And our payer partners like CMS and others are starting to see that there might be aligned mechanisms already present in existing payment models that would support adoption of age-friendly activities. In fact, on the ambulatory side, in a document that we wrote about the business case for becoming age-friendly, Dr. Victor Tabish, a health economist from UCLA, basically studied existing annual wellness visit coding, complex care coding, et cetera, and found that there was a significant business argument for increasing age-friendly annual wellness visits in ambulatory care settings, which lead to greater delivery of preventative services and additional potential downstream cost avoidance. So I think there is a strong argument in the macro environment. All these different forces are starting to come together to try to help us support the development of age-friendly activities.